Welcome to this informational presentation on key financial insurance resources presented by CDOC, the California Dialogue on Cancer. I am Elizabeth Klein, co-chair of CDOC's Survivorship Workgroup and the executive director of Wellness Within Cancer Support Services. CDOC stands for California Dialogue on Cancer. It's a coalition of stakeholders across California working together to reduce the burden of cancer. In this webinar, we have representatives of CDOC stakeholder organizations who will share their expertise regarding key financial and insurance considerations, with the goal to help and empower those facing the costs of cancer. Our presenters in this webinar include Shelly Rosenfeld, a lawyer and director at the Cancer Legal Resource Center, Monica Bryant, co-founder, Chief Operating Officer, and Cancer Rights Attorney with Triage Cancer, and Patty Falconer, President of Health Options, former Executive Director with Stanford Healthcare, and currently the Vice Chair of the Board of Directors for the Cancer Support Community in San Francisco. Our presenters will cover topics ranging from employment and disability, understanding insurance coverage and options, managing medical bills and appeals, as well as some available financial assistance programs. And with that, I turn this presentation over to our first presenter, Shelly.
Great, thank you. Next slide. So let's get started. We're going to be talking about employment and disability, but first I'd like to explain a little bit about where I work. So what is the CLRC? We provide free information and resources on cancer-related legal issues to cancer patients, survivors, caregivers. The CLRC stands for the Cancer Legal Resource Center. We're a program of the 501c3 nonprofit Disability Rights Legal Center. And the information that we provide is nationwide, and we have our telephone assistance line that we provide that information. So let's get started. Next slide. With understanding a little bit more about employment and disability. We received a huge number of questions about employment issues, so I want to cover some employment laws here. It is your responsibility as a patient to let your employer know you need help doing your job if you're unable to do so because of a disability. And it's a good idea to notify your employer before your work performance suffers. So the American with Disabilities Act, which we'll get to in a moment, and your state fair employment agency work together to prohibit discrimination against people with disabilities, which can include cancer. Now, of course, it's not illegal for an employer to fire someone whose work performance is suffering. In fact, that may be a common reason why someone may get fired. So that's why we want to make sure to add this information here at the outset, that it's a good idea to request accommodation before your work performance is affected. So let's do a deeper dive, next slide, about the American with Disabilities Act, or ADA. So this is a federal anti-discrimination law. It means it applies nationwide, and it actually protects from all phases of employment. That may actually be surprising to some folks because it includes the application and even the interview. Next slide. So the ADA, the American with Disabilities Act, applies to state and local government and applies to private employers with 15 or more employees. The ADA protects employees against discrimination if the employee qualifies for protection. There's two parts to this. The employee must have a qualifying disability. The ADA defines it as a physical or mental impairment, and that substantially limits a major life activity. Every disability law has its own definition of disability, but here we go. Under the ADA, cancer can be a disability based on this definition, and then the employee is only protected if they are a qualified employee. So qualified means that the person can perform the essential functions of their job with or without reasonable accommodation. So just by way of an example, I could not be on a football team. I don't know how to play football. So I would not be a qualified employee because I can't do the job of a football player, at least at the time of this recording. Next slide. So, of course, if the person is qualified, the employee is protected from discrimination and entitled to reasonable accommodation. So let's take a look at reasonable accommodations. A reasonable accommodation is any change or adjustment in the work environment or the way things are customarily done that enables somebody with disabilities to enjoy equal opportunity, equal employment opportunities. So for example, and again, these are just examples, so it doesn't mean that it's a guarantee that you could ask for this and get it, but it could be working from home or a change in the schedule, perhaps reassignment of some non-essential job responsibilities. It ultimately has to be reasonable for both parties, and of course reasonable for the employee, meeting the individual's needs. And when I say reasonable for the employer, ultimately that it won't force them into bankruptcy just to be able to cover that specific accommodation. It has to be something that is reasonable for them. So for example, if someone is an employee, has a standing job like a cashier, and has a disability where they can't stand for long periods of time, well, perhaps having a chair that they could take rest breaks would be reasonable. Now, of course, working from a completely separate office and not being at the cash register, well, that isn't really reasonable because the person still has to be able to do the essential functions of their job. Next slide. So we're in California, and it's helpful to understand that there are state laws in addition to the federal law of the Americans with Disabilities Act that can be helpful. So the federal law is a baseline. So the California Fair and Employment and Housing Act actually helps us get that definition of cancer. It is listed under that definition. So as opposed to the ADA that I just talked about, that it can be considered, actually in the California law, cancer is listed. So that's definitely helpful. Also, the employers, they only have to have 5, or rather at least 5 employees instead of a larger number. So that makes it easier to qualify in California, and the limitation is on a major life activity. Next slide. So if someone, if you know someone that suspects discrimination in employment, of course, we hope one never experiences that. Here is some helpful information. It's a good idea to contact an employment lawyer right away to discuss just different options. You ultimately, when it comes to your job, you have to make the decision that is practical for you. It may be something where someone is covered by both the ADA and state fair employment law. Before filing a complaint, it is a good idea to check with an attorney. Also, if you're a member of a union, it's a good idea to contact a labor law attorney. And in some cases, a lawyer might think you have a very good case for a lawsuit, or a lawyer can advise you which agency is the right one to file with. And ultimately, it's a good idea to get some guidance before you decide what to do, whether it's filing with the Equal Employment Opportunity Commission, or just deciding ultimately what to do. So here's another area that I want to cover before I wrap up. You may be able to take some time off and keep your job. So although laws like Americans with Disabilities Act and California, thank you for moving to the next slide, in California Fair Employment and Housing Act prohibit discrimination against people with disabilities, which can include people with cancer. If you need to have that time off, then the FMLA, next slide, may actually help you out in this situation. It offers 12 weeks of unpaid job and health benefit protected leave, take care of yourself or a covered family member. The 12 weeks does not have to be taken all at once. It can be taken intermittently. It's a federal law, and it's not a form of income, but you do get to keep your job and your health insurance. It can be for you if you're the one who needs medical leave, or to care for a spouse, child, or parent. Next slide. And in order to be a covered employee, you have to work for 12 or more months, or and 1,250 hours in the last year. Next slide. And while on FMLA leave, you are on unpaid leave, but in some circumstances, your employee can choose, or your employer can require use of vacation or sick leave. Next slide. And while on FMLA leave, you are on unpaid leave, but it is a good idea to check your employer's policy. There might be additional types of benefits that are really helpful for you. And also, if you need, just talking about the ADA before, if you need that extra time off as an accommodation, you can also consider asking it as a reasonable accommodation. But of course, employers don't have to keep your job open indefinitely. Thank you so much. I'm going to turn it over now to Monica Bryant to continue with her part of the presentation. Thank you.
Thank you. So as was shared earlier, my name is Monica Bryant. I'm a cancer rights attorney and chief operating officer for Triage Cancer. We are a national nonprofit that provides free education on all of the legal and practical issues that arise after a cancer diagnosis. And of course, one of those issues happens to be health insurance. Next slide, please. One of the challenges around health insurance is that it is often like learning a new language. There are words that are being used when discussing health insurance that you may not be familiar with. I will tell you, if you are not familiar with them, you are not alone. In fact, about 96% of Americans don't understand these basic terms. So when we're talking about the costs just to have health insurance, that's referred to as the premium. And that's a fixed dollar amount that you're going to pay every single month, whether you go to the doctor or not. It's like having car insurance all year, but never getting into an accident. Now, there are some additional costs that you will incur when you actually go and use your health insurance. The first is your annual deductible. Again, this is a fixed dollar amount that's going to depend on the plan, but it's what you have to pay first before your health insurance kicks in. So you could have a plan with a $500 deductible or a $5,000 deductible, but you have to pay that amount before your insurance kicks in. When the insurance kicks in, that is the co-insurance or the cost share. This is going to be a percentage, and it's the difference between what you're responsible for paying and what the health insurance company pays. So for example, if you have an 80-20 plan, once you meet your deductible, the insurance company will pick up 80% of your healthcare costs and you're responsible for 20%. Now, many plans have an additional payment called a copayment. And again, this is going to be a fixed dollar amount that's going to differ based on the plan, but it could also differ based on the service. So for example, it's very common to have a $20 copayment when you go and see your primary care physician, or a $30 copayment if you go to see a specialist, or a $250 copayment if you go to the ER. Now, one of the most important things that people should understand about their health insurance is the out-of-pocket maximum. This is a fixed dollar amount that represents the most you are going to pay for your healthcare out of pocket. And the way you get to your out-of-pocket maximum is a math problem. So you add up everything you pay towards your deductible, everything you pay towards your copayment, and everything you pay towards your co-insurance. So it's literally everything you're paying out of pocket except that monthly premium. Now, I will say, depending on the type of insurance you have, that math problem may look a little different, but for many plans, this is in fact how it works. Next slide, please. So I'd like to give you an example to show you how all of this works. Meet Dan. Next. Dan has a plan with a $2,000 deductible. It's an 80-20 co-insurance and has an $8,000 out-of-pocket maximum. Now, Dan hasn't gone to the doctor at all yet this year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, the first thing we always have to pay is that deductible. So Dan pays his $2,000, leaving $100,000 left of that bill. Now his co-insurance kicks in and the insurance pays 80% and he has to pay 20%. Well, 20% of $100,000 is $20,000. Now, the good news is because Dan has that plan with the out-of-pocket maximum, he's only responsible for paying another $6,000 out of pocket to meet his out-of-pocket maximum for a total of $8,000. Now, I am not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start to look at what it would cost someone to access medical care without the out-of-pocket maximum, it certainly becomes more palatable. And why I think it is so important for everyone to understand their out-of-pocket maximum is it allows for them to plan ahead for a worst case scenario. Now, if you'd like to hear any of that again, you could certainly rewatch this webinar, or you could watch one of our animated videos at triagecancer.org on health insurance basics that walks through the terms and that example again. Next slide, please. In the United States, there are three main places that we get our health insurance. About 50% of Americans still get their insurance through an employer. The sort of next biggest chunk of people is through the government, primarily through Medicare and Medicaid. And then the smallest number of Americans get their insurance directly from a health insurance company. Regardless of where you get your health insurance, the terms I just talked about are going to apply. Next slide. Now that we have sort of the language under our belt, let's talk about how you can go about making choices if you have different options for health insurance. Next slide, please. So I'm going to walk you through an exercise using the marketplace as an example, but know that this same analysis works whether you're trying to compare two plans sold through Covered California, whether you're trying to compare two plans offered to you by your employer. If you're trying to decide, well, do I take my employer plan or do I buy my own plan through Covered California? Or even if you're trying to compare Medicare Advantage plans, this exercise works the same. So here we have three different plans. We have a bronze plan with a $200 a month premium and an $8,000 out-of-pocket maximum. We have a silver plan with a $275 monthly premium and a $6,000 out-of-pocket maximum. And then we have a platinum plan with a $400 a month premium and a $2,000 out-of-pocket maximum. If I'm in a situation where I'm either trying to plan for a worst case scenario or I'm in cancer treatment, so it is likely I'm going to hit my out-of-pocket maximum, how can I pick the plan that's going to cost me the least by the end of the year? Can we just look at these numbers and make that determination? And the answer is actually no. We have to do the math. Next slide, please. So the way we do the math is we take one more, please. We take the monthly premium and we multiply it by 12 because that in fact is going to give us how much we're going to pay in premiums for the whole year. And then we add the out-of-pocket maximum. And when we do that for all three options, monthly premium times 12 plus out-of-pocket maximum, we can actually then see how much the plan is going to cost us, assuming we hit that out-of-pocket maximum. And when we do that with this example and these numbers, it turns out that that platinum plan with the $400 a month premium ends up being substantially less expensive by the end of the year. And so what we tend to see at Triage Cancer is that people get sticker shock looking at that monthly premium and don't do this math to really figure out at the end of the year, how much are they going to spend on care. So doing this math is an incredibly important first step. Next slide, please. But it's not just the total amount at the end of the year that we have to be looking at. There are some other pieces of this puzzle. So sometimes it might be worth paying a little bit more by the end of the year for a lower deductible, because that means it's less you have to pay out of pocket all at once. It could also be about making sure that the network of providers you see is included in the plan's network. So that means doctors, hospitals, labs, pharmacies, because insurance companies will always cover in-network providers at a higher rate. Typically, they will also only count payments made towards in-network providers to that out-of-pocket maximum. So this provider network and making sure that your providers are covered is a really critical piece. And then finally, it is a similar analysis when we look at prescription drugs. We want to make sure any prescription drugs you are currently taking are covered by the insurance company. And then sometimes we can also look to the year ahead. So asking your provider, are there any prescriptions that you anticipate I might be taking for the next year? And you can make sure those are covered under the plan before you pick it as well. Next slide, please. I often say that it is tricky to shop for insurance and make sure you're getting the right plan. The bad news, or the worst news rather, is that that's only the first step, because once you have the insurance policy, you have to make sure that you are in fact making the most of that policy. And so that means using in-network providers whenever possible. It can sometimes be hard to determine if someone is in-network. I often say check with both the insurance company and the provider to make sure they agree that they're in-network. Asking for pre-authorizations before receiving expensive procedures like scans or surgery. That's where you go to the insurance company and you ask ahead of time if they are going to cover that service. Paying attention to bills that you receive is very important. Billing is a human process and there are many mistakes on bills. And so you do have to be a diligent consumer and make sure you're only being billed for what you received. And leveraging out-of-pocket maximums. So now that you have an understanding of the out-of-pocket, you can use that information to your advantage. Thinking about, is there other medical care that you need that maybe you've been putting off due to your cancer treatment or expenses? Once you've hit the out-of-pocket maximum, many of those services are going to be covered at 100% for free. It could also be about timing or scheduling. So if you have some choices around when treatment is going to occur, trying to get that treatment all within one calendar year, so it all applies to the same out-of-pocket maximum, can be a significant cost savings. The same is true if you have a family plan with a family out-of-pocket maximum. So if 2 members have hit the family out-of-pocket maximum, thinking about, well, what other things might other family members need? Getting it in the same year could be a cost savings. Now, I'm not suggesting that someone get medical care they don't need just because it ends up being free, but in my experience, people often put off other things that they could benefit from having care for in the middle of cancer treatments because of the costs or the time. So thinking about that can be valuable. And then finally, if you receive a prior authorization denial, or you've gotten the service and you've received a denial from the insurance company, you need to appeal that denial. Next slide, please. Many consumers don't realize that when they receive a denial from their health insurance company, they have the right to appeal. We as consumers do not have to take no for an answer. Now, the specifics around appeals really does depend on the type of insurance you have, but generally speaking, there's going to be at least 2 levels of appeal. The first is an internal appeal, where you go back to the insurance company and you ask them to reconsider. If you are still receiving a denial from the insurance company, then you have the opportunity to file an external appeal, also sometimes known as an independent medical review or an external medical review. And this is where you're going to an independent agency or entity and giving them the information, and they make a determination as to whether or not the insurance company should have paid. I realize that telling people to appeal denials and how challenging appealing can be is a significant burden to put on an already too full plate a lot of times. However, we know that about 40 to 60% of all appeals are decided in favor of the patient. That means roughly 50% of the time when the insurance company says, we're not going to cover that service, they're getting it wrong. So it is often in families' best interest to go through the appeals process. Next slide, please. There are a lot of challenges with the appeals process. One of the challenges is that in order to have a successful appeal, it is typically important to gather evidence of medical necessity. That's the legal standard that these appeals are decided on. And sometimes that's evidence you can gather all by yourself, but more often than not, you are going to have to enlist the help of your healthcare team to gather this evidence of medical necessity. So if they prescribed a drug off-label, what was the rationale for that? Was there a study done or a paper released that allowed them to prescribe this drug off-label? Enlisting the help of your healthcare team is critical for successful appeals. Next slide, please. Another challenge is that there are going to be lots of conversations. So you could be having conversations with the providers that you saw. You could be having conversations with the insurance company. Maybe you're talking to that independent medical review organization. There's lots of conversations. There's lots to keep track of at a time when you may not be physically feeling well. And there's a lot of other things going on if you are in the midst of cancer treatment. So staying organized is a practical yet valuable component of successful appeals. Keeping track of any conversations you've had, the dates, the people you spoke with, the outcomes of what's going on. You can certainly keep track of this information any way that makes sense to you. We do have an appeals tracking form available on our website at triagecancer.org. You can download it for free. And it's just one way to keep track of this information. I think it's also useful because those empty boxes will prompt you, oh yes, I have to get the name of the person I'm speaking with. Or, oh yes, I should make sure I ask when I should expect a response or when I need to send the letter in. Many times we hear from patients that well-intentioned friends and family say things like, let me know if there's ever anything I can do to help. Well, you know what you can do to help? You can sit on the phone with me when I talk to my insurance company and use this appeals tracking form and take notes for me so that I can just focus on having the conversation. Next slide, please. Now, one of the most significant hurdles, I think, is really around knowledge. We find that many consumers do not know that they have the right to appeal denied health insurance claims. And so they seek alternative ways to cover those bills. We have data that shows us that 99.9% of all denied claims never get appealed. So when we are talking about financial resources and financial health and avoiding financial toxicity, this appeals process is so incredibly important. And we have lots of resources at Triage Cancer to help you navigate the appeals process. Next slide. So in summary, to have a successful appeal, it is helpful to know why the claim was denied. Gather that evidence of medical necessity so that you can prove that it should in fact be covered, paying attention to deadlines, and certainly filing those expedited appeals if you are unsuccessful at the internal appeals stage. Next slide, please. Now, even if you have the best health insurance policy and you've done all the things that we've talked about to maximize your health insurance policy, there are still going to be medical bills. So how can we deal with those bills? Once you receive a service, you're going to receive a number of communications. So just from the insurance company, you could potentially get 3 different communications. We've gotten your claim. We're now processing your claim. And then finally, you're going to get that explanation of benefits, or EOB. And the EOB is really going to outline the various pieces of information that you need to take a look at. So it's what did the provider bill, what's being covered based on where you are paying your deductible and your out-of-pocket maximum, and then how much is the insurance company going to cover. So the EOB is a very, very useful piece of mail that you need to keep an eye out for. Next slide, please. Finally, you're going to get something from the provider themselves, whether it's the hospital or the doctor or the lab, and that's going to be the bill. The challenge with this is those pieces of communication don't always come in order. Many times the providers are actually much faster at sending the bill than the insurance companies are at processing the claim. So if you receive a bill and you haven't yet gotten the EOB, the rule of thumb is actually to wait to pay the bill until you get that EOB. But it can't happen in a vacuum. You should absolutely call up your provider and say, I received the bill. However, I haven't gotten an EOB yet. It appears as if insurance hasn't been processed yet. Could you push back the due date on the bill or make a note in my file? That way you can wait until you get the EOB and make sure that everything is matching up. Otherwise, you may end up overpaying and being in a situation of having to try to recoup money from the provider. Next slide, please. When you receive your EOB and your bill, as I mentioned earlier, it is so important to make sure that everything on there is accurate. There are tons of mistakes in medical billing. If it just has codes and you don't know what's being included, don't be afraid to ask. Call up the provider and ask what is included on that bill. If you have a really complicated health history and maybe lots of different bills, there are professional bill reviewing organizations that could potentially be helpful. And then, of course, if everything is accurate and you have gone through the appeals process and you really do, in fact, owe the money that's being asked of you, you may be in a situation where you simply don't have the funds to pay those bills. And that is where financial assistance can come into play. So with that, I'm going to turn it over to Patty.
Thank you, Nicole. I am Patty Falconer, president of Health Options. In my consulting work, I bring together cancer providers, charitable foundations, and technology solutions to reduce financial hardship for cancer patients and their families. In this webinar, I will be discussing financial assistance programs. In this webinar, as I mentioned, we'll be focusing on financial assistance programs for patients on treatment plans that include chemotherapy, immunotherapy, and/or supportive drugs. Cancer patients who are receiving systemic medication that is prescribed as a pill or obtained prescribed as a pill obtained through a specialty pharmacy or administered in an outpatient infusion center are at the highest risk for financial hardship. High-cost cancer drugs may require large patient co-payments with treatment plans that may extend for multiple years. Patients are likely not aware of copay assistance programs that they might be eligible for. In this slide, which represents results from a survey conducted by the American Cancer Society, the cost of prescription drugs were a challenge for nearly a third of the patients, and only half of the patients surveyed had heard of a copay assistance program, and most had not tried to enroll in one. For those who successfully enrolled, 80% reported that copay assistance allowed them to obtain medication that they could not have afforded otherwise. Next slide, please. One sec. For patients, excuse me, I'm having some trouble with the slides. For patients who are uninsured, the healthcare team can help you apply for health insurance, access hospital charity care programs, and obtain reduced or free prescription drugs. There is much less awareness of programs for patients who are underinsured, those with large out-of-pocket costs, $1,000 or more per year for deductibles, co-payments, and co-insurance that Monica discussed earlier in this presentation. For this webinar, we'll be focusing on direct financial assistance programs, which provide eligible patients with financial support that is paid to the patient, to the provider, or to patients' creditors directly. Based on your diagnosis, medications, insurance, and income level, you may qualify for copay assistance programs that are sponsored by drug manufacturers or charitable foundations. Support grants are also available for eligible patients through charitable foundations and will cover health insurance premium costs and expenses associated with clinical trial participation or transportation, housing, childcare, and food. Next slide. So how do individuals find copay assistance programs? Please alert your provider and care team if you are comfortable Engage early in your care journey, preferably prior to initiating systemic treatment. Copay assistance programs sponsored by drug manufacturers offer free or low-cost drugs to uninsured individuals who cannot afford their medication, and for insured patients who have high out-of-pocket costs. Patients will need to know what their total personal financial responsibility will be, as Monica described, your out-of-pocket limit, diagnosis, and a list of all their drug names and manufacturers that exist in the treatment plan in order to look up programs. Program eligibility varies by drug manufacturer and likely requires patients to live in the United States and be on active treatment. Next slide. Accessing copay assistance programs through charitable foundations is much more restrictive. If you have a government-issued insurance that will require you to pay co-insurance, for example, Medicare Part B with no supplemental insurance, you may be eligible for copay assistance based on your diagnosis, family income level, and the availability of an open diagnosis-based disease fund. Disease funds can open and close very quickly, so frequent attention is required. Next slide. Support grants are available through charitable foundations to help offset the expenses associated with systemic treatment and clinical trial participation. Eligibility varies by the specific charitable foundation, but usually requires a maximum family income threshold, covered diagnosis, an opened disease-based fund, and is paid to patients or directly to creditors. A listing of foundations with diagnosis-based disease funds for copay assistance and support grants is available in the finances section of calcancer.org, which we will review now. Next slide. The California Dialogue on Cancer Survivorship Workgroup has developed a web page within the calcancer.org website, which includes practical support resources that are designed to help people navigate the healthcare system and deal with the many challenges of living with cancer. This includes resources that will help with finances, health insurance, end-of-life planning and care, transportation, and more. I will now walk you through how to navigate the Resource Hub, which is available to patients, healthcare teams, family members, caregivers, and everyone needing information on financial resources. To view the different financial resources, please visit on your browser using the direct link on this slide, www.calcancer.org/en/practical/finances/ or go to www.calcancer.org and you will be directed to the website's main page. Next slide. On the main page you see here, the survivorship hyperlink is in the lower left side of the page, where it will direct you to different categories of resources available. Next slide. For this webinar content, please pick the Practical tab on your far right, where you will find resources on topics such as finances, legal, work, employment, practical support services, clinical trials, health insurance, care and end-of-life planning, and more. Next slide. In the practical subpage you see here, please click on the Finances tab, where it will direct you to the content we discussed in this webinar today. Next slide. On the left side of the Finances page, you will find resources for managing insurance and managing finances. On the right side, you see one-on-one help understanding and managing finances, which includes links to organizations which provide financial navigators who can identify potential financial assistance programs that we discussed today and assist you in enrollment. You will also find a National Resource Finance Directory page, which will, and you can enter your age, insurance, state of residence, diagnosis, Then you will be able to identify from over 40 programs of financial support, programs that you might be eligible and interested in. You will also see links to organizations that provide direct financial resources and links to organizations where you can access health and social care providers and advocates. Our goal for the calcancer.org finances webpage is that it will help reduce financial barriers to equitable care for all California cancer patients and their families. And now I will return the presentation back to Elizabeth. Thank you.
On behalf of all those who presented today, Shelly, Monica, and Patty, as well as all of us at CDOC, we hope you found the information provided in this presentation both helpful and empowering. The financial burden of cancer is real, and it can be overwhelming. We invite you to continue to explore the information, the concepts, the resources introduced in this presentation, and perhaps even reach out to these CDOC stakeholders who presented today, as well as explore other CDOC resources or connect with organizations in your community for support. Next slide. If you have any questions, please send us an email at cdocshare@gmail.com. Thank you.